Hello, I'm Dr Annalene Weston, dental legal consultant at Dental Protection, and welcome to RiskMatters, our latest series of podcasts created specifically for dental practitioners in Australia. As the name suggests, RiskMatters is all about managing risk. And in this podcast series, we'll be taking your feedback and queries and putting them to leading industry experts, getting them to answer the difficult questions about managing risk and working safely. It's about what to do when managing risk matters most. Now, in this edition, I'm joined by the fabulous Dr. Trudy Lin. And while we're intending on talking about achieving balance between our clinical and personal lives as a potential risk management strategy to explore, once you meet Trudy, I think you're going to agree that this podcast is likely to roam past that topic. So Trudy, hello, I'm so pleased to have you with us today.
Thank you. Thank you for having me.
No, we're really excited. I did want to start by reading your bio for any listeners who haven't had the privilege of meeting you, and then we'll dive in. Is that okay?
That sounds great.
Dr. Trudy Lin is one of 27 specialists in special needs dentistry in Australia, and she's the founder of Extra Mile Dental, South Australia's first private special needs clinic with home visiting services. Now, Trudy's on the Royal Australasian College of Dental Surgeons Board of Studies for Special Needs Dentistry, and she's also an examiner for the Australian Dental Council. She's involved in various national and international advocacy roles, and I'm going to put a link in the episode notes to Trudy's full bio so you can see for yourself all the great work that she's doing in this regard. I struggled to cut this bio down, Trudy, because I wanted to showcase everything that you do. Now, Trudy's extraordinary achievements have led to her being recognised with multiple accolades, including 2022, she was the Young Australian of the Year for South Australia. 2021, the Young Achiever of the Year for South Australia. 2017, she obtained a fellowship to the Pierre Fauchard Academy, followed by a fellowship to the International College of Dentists in 2022. And I love this. Trudy was one of the 10 ordinary Australians, and I love it because I don't see you as being an ordinary Australian, but that's quite charming. Invited to attend the funeral of Queen Elizabeth II. I mean, that's huge. In addition to her clinical work, and really, I guess, why we're here today, Trudy's also a certified mindset coach and workshop facilitator for the South Australian Health Leading Clinicians Program. She runs a private coaching practice called Extra Mile Coaching, which specialises in career coaching for dental professionals. And then the last thing I wanted to mention, because this really warmed my heart when I saw it, during the COVID-19 pandemic, Trudy established, in all her spare time, a supported independent living facility for people with disabilities to live in the community. So, or you may be many things, Trudy, but I don't feel that you're an ordinary person. In a good way. So thank you again for joining us. And I suppose I wanted to start in many ways where your journey in dentistry started, with special needs dentistry, because I was aware that there weren't many of you, because as you may recall, we did a previous RiskMatters with Dr. Andrew Lee, who talked about that. And from memory, he said that if all the patients with special needs only saw a special needs dentist specialist like yourself, it would take several years before anyone even got to have a checkup. Is that right?
Yes, that's right. So we're a bit of an endangered species. Like there's 27 of us in the entire country, and 1 in 5 Australians currently are living with some sort of disability. And recent statistics show us that 47% of Australians are living with some sort of chronic medical illness, which also falls into that banner of special needs patients that we look after. So you can see with the huge disparity of the big overwhelming need and such few specialists, I'm a huge advocate and very supportive of getting as many clinicians as possible to be seeing and being upskilled and feeling prepared to see patients who are more of that milder to moderate kind of complexity, so that then the most complex patients can be referred to the specialists.
Yeah, that's great. So what can we do then as general practitioners to help with that burden? Because those are some big numbers that you were saying just then.
Absolutely. And so I would say that there's a lot of things that we could talk about, because special needs dentistry is so broad.
It's huge.
So I'll stick to some high level kind of principles. And I thought that because of the fact that we're looking at risk management, that potentially we can talk about some of the risk management strategies. So one of the things that I would say with looking after patients that have special needs, particularly those that maybe require supported decision making or have a third person that's assisting them with their consent, that it's really important to then gain collateral information and history in relation to their medical status. So contacting their general practitioners or their medical specialists for a full medication list rather than relying on the patient's self-report or even someone that's a caregiver, because they don't necessarily have the same health literacy as someone that is a medical professional. And so there can be many things. In today's day and age, we know that there are a lot of extra things that cause MRONJ, and also for example, denosumab is a very common one that's not reported by carers because of the fact that it's so infrequently given, only twice a year. And so that's a really big principle that I would emphasize to as first kind of port of call.
It's really speaking my language, Trudy, because I think what you're saying there are absolutely applicable in your field of work, but actually in every field of work, we often don't get that medication list off the patients. And even if we do, we don't get the doses. And something that Jerry Moses always really states is how much of that is that person taking, because the actual dose itself can be quite relevant. Yet so many of us will just put cholesterol tabs. That's probably not really the fulsomeness of the information.
Yes, a little bit more specificity is probably necessary. So I love that you pointed that out. I 100% agree that dosaging is very important as well, particularly now in the therapeutic guidelines. We know that MRONJ risk is very much affected by things like their comorbidities as well as the dosage and how long they've been on the medication for. And those types of things are very hard to gain accurately through a verbal history or even a filled out medical form by someone that's not a medical professional. Yeah. So that would be a key principle. Again, following along the lines of risk management, and I'm just drawing from what feedback I've gotten, because I do engage in quite a bit of CPD for special needs dentistry, and I get a lot of feedback that's something that really jumps out, that general dentists come up to me and say, oh, I'm really glad that you told us about this because I didn't know about this, is having some level of awareness around when a person that has a renal condition, because that's something that can kind of go under the radar, especially because a lot of more elderly patients, so this may comprise a really large proportion of your patient demographic, patients that slowly get older. We know that by the time that they're reaching the age of 65 and above, that the renal function starts to decline. And even if they don't have a diagnosed kidney condition that you're aware of, their kidney function will start to decrease from that age onwards. And so then things like prescribing medications and the amount of local anesthetic that you inject,
just about to say,
that all becomes
so
very relevant. And so again, I kind of point that one out because I know you've got a very well-educated audience, the fact that they're listening to this podcast. And so I'm just going to hone in on those 2 points to say, you know, these are things that can go a little bit under the radar, but if you're able to focus on those 2 things, it will go a long way in ensuring that you feel comfortable that there aren't any blind spots or things that are going to take you aback that might put your patient inadvertently at harm. Because I'd just like to share this part, which is that, you know, I've just been I feel so humbled and so grateful to be someone that is, I guess, like since the award, it's led to a lot of people coming to me to ask for advice around special needs dentistry. And I can just see that there are so many well-meaning practitioners there that just want to do their best by their patients. And so they say to me, I really want to look after patients who have more medical complexity or disabilities, but I just feel like, you know, what if there's something I'm missing? Or I don't feel like I'm adequately equipped to really look after them and provide them the best sense of care, which is why I refer to a specialist. And so what I'd like to really say is that I think it's just wonderful to see that people are really wanting to do that. And if we can help fill in those gaps and give you that assurance that, yes, like if you can do these things, like get the full collateral history, to be mindful of those things that go under the radar, such as denosumab and renal conditions, if we can raise awareness and educate around them, it would then help to increase access to care for people with special needs all across the country. And so, and when you decide to do that, it's not just about you being able to make a really great impact in terms of that person's access to oral health care, it also, you are contributing to creating more inclusion in our society, because people with disability, people with medical conditions, they can face a lot of other barriers outside of just the oral healthcare sector, that
Absolutely.
you taking that step, and even if you end up learning a little bit more CPD every year to upskill and feel more confident in just looking after this patient demographic and see a couple more patients every year, that will actually make a huge difference to the number of patients across the country that will actually be able to access care in a more timely manner. So the last bit of advice that I would say is that, there's 27 specialists, so quite a few of us are like me, managing different priorities, and we kind of spread really thin, but it's all of us are so passionate about trying to, support practitioners and support our patients best we can, that reach out to whoever who's in your local state that's a specialist, and reach out and just ask questions, and I'm sure that they'll be very willing to respond and to help support you in your journey in feeling comfortable and equipped to be able to look after the patient demographic that we do as well.
Thanks, Trudy. That's such a powerful message, and I think really is food for thought. And what you say about specialists is true. I mean, I know there's not many of you, so I know most of you, and you're all absolutely lovely and would be delighted to help anyone. But most specialists are more than happy to help, aren't they? Across every field, particularly recent graduates sometimes I think are anxious to reach out, particularly if they're unsure or if they've made a mistake, because they're worried they're going to be judged or they're going to be blacklisted. But I would encourage anyone, particularly recent graduates who want to learn, just reach out. Specialists will make all the time that they can for you, don't you think?
Yes, I agree. And the thing is, people say, "Oh, thank you for making the time because you're so busy." They read my bio and they know that I do a lot of different things. But I also feel the thing is, yes, give us some days to respond. But the thing is, life will always feel busy, and it's about carving out time for the things that matter to you. And so what I find is that people that end up going to specialty training, we really, really care about our specialty. That's how we ended up there. And so we will give us some time to respond, but we will do our best to try and at least link you in with someone or provide resources to support you or be able to point you in the right direction. So
no, that's fantastic. Thank you. And you've actually nicely led me on to my next question. So specialist training isn't for the faint-hearted. It's a huge commitment. And we find a lot of recent graduates when they're first graduating and they're exploring dentistry and they're trying to work out what they want to do. What advice would you have for just generally I mean, it might not even be recent graduates, it could be anyone, of course, who is considering a specialist training pathway. And of course, you've said how you found special needs, or I don't know if you really have said how you found special needs dentistry, or if I'm just inferring it from your passion, but I'm curious to know about that too. So tips for people considering a specialty, and I guess what was your driver, I guess?
Yes, great. Well, I think I'm happy to share how I came to special needs dentistry, and that probably will encapsulate some of the lessons that I've learned and would help support anyone that's looking to pursue specialist training. So I think it makes sense for me to start from the very beginning of what drew me to dentistry in the first place, because it really interconnects. Is that really it was really a lot of influence from my family's lived experience. So I came to dentistry because my dad had a very severe form of tetracycline staining. And so very, very severe that it affected the entire surfaces of his teeth, and also very dark brown staining, very brown and gray. And so I grew up just seeing how much of an impact that oral health has on so many aspects of your life. So he also, because he was so ashamed of how his teeth looked, and he wasn't told that it was because of tetracycline antibiotics that were taken when he was younger, he thought that he had done something wrong, that he didn't look after his teeth properly, and so he would scrub them day and night. So he ended up having a lot of attrition and wear and sensitivity to his teeth. So I could see how having poor oral health can affect your ability to eat, but also your ability to socialize. And my dad also found it really difficult to find a job and employment because people were judging him based upon how his teeth looked as opposed to his qualifications. And so that really had a huge impact on me growing up. I just developed this passion of, I want to be a dentist. I want to help people not have to go through the same challenges and suffering that my father did. And then the way that I found my way into special needs dentistry was, again, from my family's experience. So my youngest brother, Aaron, was diagnosed with autism. And I also have various family members who also have, I guess, fit into that special needs category. So I had two grandparents who passed away from cancer. And also I have an uncle who is currently suffering from dementia and Alzheimer's. And so having these family experiences that then showed me all of the additional challenges and barriers and how oral health is so intricately linked with that and causes more challenges for them into day-to-day life, really, it just led me to develop this passion. And because I could see the need, I felt like I was well placed to be able to help serve people and prevent them from having the same kind of challenges. And so that's really what led to my journey to becoming a specialist. And here is where, I'd like to be able to, I guess, share with any of the members of your audience that might be considering specialist training, that, sometimes you might look at specialists and you think, oh, wow, I could never do that because they just seem so put together. They just seem so capable. What you're doing is you're comparing our endpoint after we've finished specialist training to your starting point, where you're just now looking at and considering and deciding what you want to do. Now, so this part of my story I want to share as well is that once I realized that I really wanted to contribute to the profession through being a specialist in special needs dentistry, I had this passion. The other piece of it that needed to work through was I had all these self-limiting beliefs and doubts around whether I had what it took to become a specialist. I knew I had all this passion, but I also worried that, because I know that I get emotionally attached to patients, and that's where my passion comes from. It's like a double-edged sword. It also what made me really understanding, and patients connect to me and feel like I could really help them in a big way. But it also worried me that maybe I didn't have the resilience or what it took to then have that be everything that I did. So only look after this patient demographic. And so this actually relates well to what we were going to talk about later, which is more about my mindset coaching and how I came to that, is that when I was going through that period of time, I was in my second year out after I finished dental school and wanting to pursue the specialist training, but struggling with these self-limiting beliefs about whether I could do it. And then I was fortunate to be supported by the SA Health Leading Clinicians program. Mm-hmm. I had an amazing coach. His name was Dr. David Holden. So big shout out to him if he ever decides to listen to this podcast. He was a palliative care consultant, and he was my leadership coach for that year that I did that 12-month leadership program. And in those sessions together, through the coaching that I received, he helped me to overcome those self-limiting beliefs and then commit to becoming a specialist. And so after that year of doing that program and having that coaching, I then had the courage to then apply for specialist training, and then I started it the following year. And so to all of the young practitioners, or maybe you might not be young, you might also be later on in your career and considering specialist training, just know that, and I'm sure that if you spoke to any other specialist, that they probably have gone through their own journey and had their doubts that they had to wrestle through. So don't let any self-doubts that you have about whether you're capable or able to do it hold you back from pursuing what you feel you want to pursue, because that's not a signal that you're on the wrong path. If anything, that's something to make you curious and go, you know what, I wonder where this is coming from. Let me have a look. What can I utilize around me that could give me support? Shall I go and speak to some specialists that I know that are in that specialty and get some insight from them? Shall I go and do a bit more CPD and see, what's out there? Or maybe even get a mindset coach. I mean, that's what personally really helped me. And that's also what's led to my passion for mindset coaching and becoming one, and then becoming a facilitator for the SA Health Leading Clinicians program. So yeah, that's what I'd like to share in terms of advice. I just think Everyone has their own personal journey, their own strengths, and if there's something that's drawing to you to a particular specialty, like, don't ignore that flame. Just listen to it, let it grow, and don't let the doubts kind of snuff it out before you have a chance to really explore it.
Oh, that's really helpful. Thank you. I was thinking that we might pause on the special needs dentistry aspect because I feel like we could talk about it forever.
Yes.
But the other reason I wanted to talk to you is the one of the other parts of your role, because the last time you and I saw each other was at the RACDS breakfast workshop in Cairns. You'll probably remember you were the keynote speaker at a workshop called Juggling Your Priorities. And this was something that you were doing not as a special needs practitioner, but as your role as a double certified mindset and leadership coach. So I understand how you ended up at special needs. And I think it's interesting that somebody had to help you overcome some mindset. No, issues is the wrong word, isn't it? The frame of mind that you were in. What would we describe it as? Help me out here.
Yeah, so the thing is, I would say, I mean, I call them self-limiting beliefs because the thing is, they just come from yourself, and a belief isn't necessarily based in fact. For example, beliefs are something that we develop and we change over time, and they are moldable. So what I believed about myself at the time, struggling with imposter syndrome and whether I had what it took to complete specialist training, they were not rooted in fact. They were just things and beliefs. So one of my definitions that I use for in terms of what a belief is a thought is a sentence in your mind. It can be a visual kind of representation, but the nature of the way that I take my clients through mindset training is through thinking of it as a sentence, because a lot of us resonate with language and hear our voices to ourselves and our beliefs being told to ourselves in a particular voice. And so if you think about a thought is a sentence in your mind, a belief is just a thought that you've practiced many, many times, that you've just heard a lot of times. It doesn't necessarily mean that it's the truth or it's based in fact. It could be something that you've just picked up over time from society, has like certain messages that it gives to us from the day that we are born until basically the day that we die. And so some of those beliefs are ones that we've unconsciously picked up, and we haven't had the chance to intentionally sift through and decide on purpose which ones serve us and which ones are not assisting us. And so that's one of the things that I really like to practically have exercises which I recommend for people to look at that, particularly if we apply this to wanting to pursue a career goal that you have or enter specialty training, really working out which thoughts and which beliefs are going to drive you towards that and which ones that you can leave behind because they're from an old version of you, a version of you that wasn't quite as an intentional around what it picked to have in there.
But wasn't real as well, because it was formed on facts that weren't true. Because it was, your mindset was, or your unhelpful mindset was telling you things that you were listening to that weren't necessarily serving you and weren't based in fact. So yeah, okay. So you had this coach, this leadership coach, you're doing your specialist training. When then did you pivot to the mindset and leadership coach, becoming one yourself?
Yes. So in that, so I did the 12 months in the leading clinicians program as a participant where I was coached. And then my coach, he said that he recommended that I then become a facilitator and become a coach myself the following year. And because of the amazing impact that it had on me, I really wanted to give back to that program. And also I then learnt about the power of coaching. And so I became a leadership coach for the SA Health Leading Clinicians program that following year. And then after that, I really, this was like in my second year of specialist training, is I actually started to really delve into specifically mindset-based coaching. There's a lot of different types of coaching out there, but what resonated with me with mindset coaching was the fact that it's science-based. It's based upon cognitive behavioral theory. So I guess it's being a healthcare professional where we're taught about evidence-based dentistry, I just really resonated with the mindset coaching. And so it was actually more of a personal development endeavor where I decided to then become formally certified as a mindset coach. And to apply it in real time, I also then ended up doing a fundraiser and running a 105-kilometer ultra marathon that year to fundraise
Of
for
course
the
you
Cancer
did.
Council. And that's how I was applying my mindset coaching in real time, was that I went, well, okay, so I've learned about the power of being intentional around what beliefs that you are letting have airtime in your mind. And I could see how the ones that I formed before were about whether I could become a specialist were untrue. And then I went, let me experiment and see if there's something else in my personal life that I can break through that barrier for, so that then my brain has evidence of the fact that the next time it wants to offer me something that feels limiting and telling me that I can't do something, I'll then have this tangible evidence to be able to show, well, you didn't think you could become a specialist, and now look at what you're doing. And so I picked a belief that I'd held from childhood, which was that I've never been good at sports. Like I've never been good at running or anything like that, because we're on a podcast, so you can't tell how short I am, but I'm very short. Like if you looked at me, you wouldn't pick me out to be a good runner or anything like that. Definitely don't have the physique or build for that. And so then I went, you know what? That's a belief that I've held about myself, that I could never be a runner. I would never be athletic. Let me see if I can use this mindset coaching techniques that I've been learning, and apply it to myself and overcome this huge mental barrier that I had. And, well, the end of the story. I did end up being able to run the 105-kilometer ultra marathon. And then now to this day, I look back and like what it does is, on those hard days where I'm thinking, oh, I don't know if I can break through this ceiling, the doubts are coming up, I then go back to those, I guess, two big breakthroughs in my life where you didn't think you could become a specialist, and look, now you are. And you also didn't think you could be a runner, and now you've run an ultra marathon. So if you can do that, you can do anything.
Oh, that's really great. Can I just ask, I'm curious, one thing we talk about from time to time on this podcast series, and generally whenever people come to dental protection presentations, is this concept of safe failure. Because one issue
Yes.
that we have for a number of clinicians is they're high functioning, high performing, incredibly intelligent people who've never failed anything in their life, not their driving test, not an exam. And so the first time that they face failure is when something goes wrong in a clinical situation. And because they've never failed as a young person, as a child, for example, they haven't developed the skills to support them, the emotional, mental skills to support them through what happens next. And so we tend to find that they'll freeze, or sometimes they'll make some really bad decisions, sometimes both. And it's because they've never experienced that feeling. So one thing that I'm a big advocate of is safe failing. And I choose to say failing, challenging my self-limiting belief. So my husband's a black belt in karate. Now, he has to be married to me. No, I'm joking. No, but he is a black belt in karate. And I look at him and I think I could never do that. I'm too old. I just can't do that. And so for one reason or another, I started my karate journey a couple of years ago.
Congratulations.
I know, right? I know, it's terrifying. And I'm now a purple belt. So I'm challenging those beliefs myself as I go. So I've still got a couple of belts before I get to an open black belt, but I may never get that, and that's okay. But part of the reason for me doing it is essentially I have my ass handed to me every week on that dojo floor, often by like some 15-year-old or something. Karate is martial arts is a real I don't know, it's a real lesson in humility, shall we just put it that way. But one thing that I found really, really helpful with it is that the worst thing that happens if I fail is nothing. Doesn't matter. And that has been really helpful to me in other aspects of my life. Now, do you have a view on safe failing, or do you think it's just something in my imagination?
Oh, I wholeheartedly agree with this concept that you called safe failure. So, I'm a big fan of, again, we're on this mindset coaching journey.
Yeah,
So this is
we
very
sure
much
are.
my mindset coaching
I'm loving
type
this.
of
It's very good for me.
conversation here, is that I I completely relate and understand and acknowledge that there is a lot of fear around failure. And it's completely understandable because if you think about the way our educational systems and institutions have brought us up, it has created these circumstances where it doesn't feel safe to fail. And here, the definition of failure is not getting, let's say, everyone has a different definition of failure, right? 100% on a score. Or if we apply it to dental school, it's very much about your assessment, whether the filling ticks the criteria that's been assigned. Otherwise, you've failed as a clinician. So the thing is, it's really understandable when we then go through life and we've had all of these influences and these definitions of failure being a bad thing being put to us, that there would be this real fear around failing well into adulthood. And I certainly relate to that until when I started to discover this mindset coaching and these techniques, I started to reframe failure, that instead of failure being a bad thing, it's actually success in progress. So when you fail at something, instead of thinking of it as being a bad thing, it's actually a sign of your courage to then go and try something new, or go ahead and actually put your hat in the ring and try something. And what it does is every time you fail, it actually just gives you more data and information so that, you either get what you want, which is great. You end up getting, winning like the race or whatever that you set out to achieve, or you end up learning. So it's a win-win either way. The negative association with failure is actually one that's just in our minds, something that we've just absorbed from society because of the messaging that we absorbed unconsciously as we were brought up in those institutions. But then once you discover that you have a lot of agency and you can be empowered to decide, well, I'm no longer going to perceive failure as something that's negative or anything. In fact, I'm going to perceive it as a positive thing, as a sign that I'm heading in the right direction, that I'm growing, that I'm learning, and that I'm putting myself into a position where I'm going to be going for my goals instead of staying still and being afraid of what might happen if I don't try.
No, that's great. Thank you. I'm curious then. I think I know the answer to this, and I think I know what your answer to this is going to be, but who do you think benefits from having a mindset coach? Who do you think really benefits from that? Everyone or just some people? And is there a time when it is a better fit?
Yeah, that's great. I really like that. That's a very thoughtful question in terms of the different parts of it. So, in terms of who would benefit from a mindset coach, I mean, I can speak from my personal experience and from those that I've coached before that it can have immense benefits for anyone that's seeking support, that's about trying to utilize your own agency and feeling empowered to make decisions and live your life with more intentionality. So, no, I think it's tricky to say that that would resonate with everyone, but I do recommend that people at least be open-minded to it and explore it, because to provide some clarity around what I call, or my definition of coaching, is that because our profession is exposed to a lot of mentoring, I'll use that as a bit of a comparison. I'm a huge advocate for both. Like
Absolutely.
mentoring is really, really very useful and very valuable. And then coaching is also valuable, but in a different way. So with mentoring relationships, it's usual that we'll seek someone that has more experience, and then they give advice and direction and knowledge to then the person that they're mentoring. And sometimes it can be quite directive. Um, the difference between mentoring and coaching is actually more about um, asking questions to facilitate and empower the person being coached to find the answers within themselves, as opposed to being given the answers by someone that's been through it and had the experience before. So the analogy that I like to use is, in a mentoring relationship, the mentor is the person that has the gold. The gold is like the wisdom, the knowledge, the experience, and then they share their gold with their mentee. In a coaching relationship, the opposite is true. The coach, their job is to see the gold inside their coachee and then find a way to help that coachee tap into that gold themselves. And they do that through reflection, through asking questions, and then increasing the amount of awareness that that person has to empower them to draw upon their own wisdom and their experience.
Oh, that's a really good analogy.
Mm.
I think as well, sometimes as clinicians, we can have a tendency to try and do everything all at once. And I think that if you already have a lot on and you're perhaps not getting a lot of sleep because you have a young
Mm.
family, for example, maybe coaching might be really helpful. Or it might be it's something that you deal with this and then you start looking towards that maybe. I don't know. I think sometimes we tend to try and do everything all at once and we set ourselves up to failure a little bit. Not that there's a
Mm.
problem with failure, as we've just said, but we don't get as much from it as we perhaps could if we don't do it. I don't know. Do you think, or do you think it wouldn't really matter? Do you think just do it whenever?
Yeah, so I think so this relates to your other like question, which was around, is there a good timing? And I feel like that's very individual to each person. But I would say that um with people that, I guess I'm going to relate to the clients that have come to me for coaching. They're all at different points in their career journey or their life journey, but the common denominator which led them to reach out was about them having tried a lot of things independently themselves. And so, we have a
Ah,
really, well educated, like anyone that in our profession, and that's kind of the niche that I work in, is I coach like dental professionals. They're all very highly intelligent individuals that have done their own research, who have spoken to friends in their life, they have mentors, they have other colleagues that they've spoken to. Um, and they feel like they've maximized all the avenues that they have at their disposal. And then they're looking for something new, something that they haven't had before, because perhaps there's something that's happened in their professional, personal life that has now sent them feeling like, I'm a bit more saturated now, and I feel like I need some sort of extra support to help me. And then that's where I find is the perfect time for a coach to come in, because of the fact that a coaching relationship is very unique and different from any other relationship that I guess like people might have experienced before. I know that was certainly the case for me in terms of um, to give like some personal examples. I had a lot of friends that I would talk to around different things, like sharing about my self-limiting beliefs around, oh, I don't think I become a specialist because I'm too emotional and all these things. And my friends would provide like empathy and, and well-meaning advice and support in that way. But what my coach provided me, and this is the thing, is like a coach, their job is to be able to work together with you and have a bird's eye view. So they don't have any preconceived notions about what you've believed about yourself in the past. All they're doing is they're looking at your thoughts with you together and going, huh, like I know you've believed this for a lot of time in the past, but do you really need to believe that? In a coaching relationship, like sometimes a coach is prepared to say things that might not be something that you're used to hearing. We're willing to step in there and challenge your beliefs as opposed to agree with what you've already believed or what you already know about yourself. And so the analogy that I use is that sometimes, um, and here's the thing, like we want to be able to utilize all the strategies and resources available to us. Sometimes you want to have a friend that will jump in the pool with you and then together just be commiserate with you and go, yes, oh, this is terrible, like so it's so hard and things like that. And so I call that like jumping in the pool with you. The coach's job is to stay out of that pool, so the pool being your thoughts and your beliefs and your situation. The and when we are outside of the pool, when we're looking in, we then offer a different perspective and a different vantage point to then be in a position to help you potentially pull yourself out of that pool that maybe you weren't even aware of. You thought that these thoughts that were in your mind were actually rooted in fact, when in reality, we then, as an external person that doesn't know much about your history, can look at it and go, Well, I'm not buying it. I don't necessarily think that that's based in truth. I think that's just a thought. And the thing is, with mindset coaching, you learn that you have agency to control those thoughts and influence your thoughts and change them into ones that can be more self-serving as opposed to ones that hold you back.
That's a great analogy. And I think I understand better than I did coming into this call what the role of a coach was. But also, I think it's really interesting that you've mentioned that it's somebody that doesn't have any preconceived beliefs around you, because I think, unfortunately, through no fault of their own, one of the limiting things when you do try and speak to people who know you is that they can double down on those limiting beliefs, because sometimes that might be where it came from.
Mm,
And sometimes that limitation of belief might be a reflection or an echo from their limitations that you're absorbing. If you think about family situations as an
mm.
example, it can actually be that you just become an echo chamber. So having somebody who doesn't have those preconceptions of you, I can absolutely see how that could be incredibly helpful. Incredibly
Yes.
helpful.
Yeah,
Yeah,
that's
that's
very
brilliant.
insightful what you just shared.
Oh,
I
why, thank you.
completely agree. And also, this also brings me to another point, which is what feeds into my passion for coaching and and I guess like led to me wanting to then offer this to people in my profession is that there is a lot of stigma around health professionals in general seeking help or support,
Absolutely.
particularly for things like their mental health and their
And it's
general
so
well-being.
wrong.
Sometimes
It's so
people kind of
wrong.
perceive us like, even though we're human as well, but they see us as, well, you should be infallible and you're just a health professional and and all that. And what I found is something that really keeps me going in terms of wanting to raise awareness around the fact that coaching is an evidence-based and really effective tool to help support you, is that there's much less stigma associated with seeking the support of a coach as opposed to, let's say, seeking psychological counseling or anything like that. I know that there's been quite a few practitioners that have shared with me that they're concerned about, well, we're talking about risk here in terms of like APRA and things like that, in terms of if people find out that they have sought
Yeah.
mental health support, whether they're fit to continue practicing. But one of the things that I love about coaching is that if we are proactive and if you're at that point where you can see that you're wanting some extra support, coaching can be something that can be very appropriate at that time where um, by managing your thoughts, you can really change the state in which you're feeling. And some of these patterns that create anxiety in our bodies are actually things that we've just learned over time and can be things that can be reversed through things like getting an external perspective that then helps you to challenge those thoughts which are creating those feelings. So
Yeah.
that's
No,
something that I'm a huge advocate for in terms of people having access and knowing that there are other different resources that they can call upon. And of course, there's always going to be a place for mental health support and a time when that is critical and necessary because there is a scope in which coaching is able to support. But the earlier that people are looking to seek that support before it gets to that point, the more that we can help enable our profession to then not be getting to that phase. I mean, we're all about prevention over intervention, right?
absolutely.
And so I feel like coaching is the equivalent of our preventative things that we do in dentistry in terms of regular checkups and fluoride and cleanings every 6 months. It's the same thing. Like if rather than waiting until your mental health is at a really severe, dire state, in which case you'd need to seek, psychological support, if like before you get to that point, you're proactive and seek the support of a coach, then it means that you may potentially not ever need to experience those really challenging kind of like mental health conditions that might otherwise be really tricky to then seek support from because of the stigma.
Yeah, wouldn't that be helpful? I do
Mm,
just want to pause just to say, of course, that if you do get support from a counsellor, it is not a black mark against you with ARPRA. They don't hold it against you. And it is a commonly held belief that people have. And it's absolutely not the case at all. ARPRA would never want to get between people and their wellness. And I'm not being paid by ARPRA to say that. That would actually be based in fact. So I just want to pause and say that. What I wanted to spend our last bit of time together, Trudy, is we're talking about mindset coaching, and I really wanted to take some time to explore some techniques with you that would be really helpful for people who are listening and their interest is piqued and they want to understand a little bit better some of the types of things that it involves. So going back to that breakfast, um, I was sat, I don't expect you to remember, but I was sat at a table with a whole load of high flyers. Okay. And but I was, and that's great. And there was something that you were talking about, and I could see it really impacted them. It was like a jump back moment. And you were talking about reframing. Now, as someone who suffers with anxiety or lives, I don't know, anxiety is my best friend, or however I'm supposed to put it, I am an anxious person. Um, Reframing is something that I'm very, very familiar with, because out of all the tools in your toolbox as someone with anxiety, reframing is right up there as a real power tool. So, because of the effect I saw it had on all those other people who, as I said, were incredibly high flyer, high functioning, super, super smart leaders in the profession, and they were like, wow, this is really helpful. Could you share with our listeners what reframing is and how maybe it could be helpful to them in day-to-day dentistry to stop that freeze that we were talking about, or that spiraling into really unhelpful thoughts? Would that be okay?
Yes, yes, absolutely. Thank you. That's very kind of you to, yeah, like I'm just really happy to hear that it resonated.
Mm,
Um, and
so much.
so, yes, like this is by far like a really big part of proponent of mindset coaching is around managing the thoughts or the sentences in your mind, to use my definition, because and this is all science-based and based in evidence, is that cognitive behavioral science teaches us that your thoughts create feelings, and then your feelings are what lead to your actions. Um, and so our thoughts, every time you have a sentence that runs through your mind, and that thought will create a feeling in your body. Now, sometimes we might have a lot of thoughts that race through, and so we don't necessarily attribute every single feeling that we feel in our body to those sentences. But the language that you use with those sentences holds immense power. And one of the things that we did in that breakfast was, because it was an interactive workshop, I had the participants do some thought management exercises where you trial out a sentence in your mind and then check in with your body to see what kind of impact it's having. And so, in a podcast setting, it's probably a little bit trickier because I won't get the feedback from your audience. But I invite anyone that's listening down to really think about. So this is like a practical exercise that anyone listening can engage in at the moment, which will help you to gain some more awareness around the impact that the sentences in your mind are having on your experience in your day to day. Is I invite you to bring to mind something that you have been putting off, that's been on your to-do list, something that you've been dreading and been procrastinating getting done. And just think about completing this sentence for me. When I get back to work tomorrow, or whichever day it is, I have to, and then insert whatever it is that you are dreading or not wanting to do. And then I invite you, and this works well as a written exercise as well. So writing it down, that sentence. And now I invite you to write that same sentence down underneath your original one. And this time, cross out the word have to, and then replace it with one of these three alternatives: get to, want to, or choose to. Whichever one of those three you feel resonates the most with you in the context of this sentence. Now, I want you to read out in your mind the first sentence, I have to, and then insert the blank, and note what feeling that you have in your body. And a lot of the time, the feedback that I get is that it will be a feeling of dread, tension, it will feel
Absolutely.
heavy. And then I'd like you to read in your mind to yourself the sentence below, the variation where we just tweaked one word. I get to, I want to, or I choose to, and then insert the thing. And then check in with your body. What feeling comes up this time? Generally, what I find is that the feeling is lighter, it's more open, they feel more motivated, they feel more empowered, they feel more able to actually go ahead and do what they need to do. And so then you can reflect on whether there was any change, and then which one of these do you think will be more conducive to you actually being able to get what you need to get done on your to-do list. So here we go, like the circumstances haven't changed, the situation hasn't changed. You've still got that thing that you were dreading or you needed to do. And yet by being intentional around what words that you're using when you speak to yourself and tell yourself that you have something that you have to do, as opposed to, oh, something that I'm choosing to do because it's important to me, can then really change your day-to-day experience. And then that flows on to then to impact like what kind of actions you take and what kind of progress you can make on things that are important to you.
No, it's great. That's really great, Trudy. Thank you. And it's funny, I always find the choose to for me is really helpful because then it feels like it's my idea and that not that
Yes,
it's something that I have to do. Because like I have to. That can feel really crushing.
yes.
Whereas I choose to, that's good. But I also like I get to because then it almost
Mm.
feels like actually it's a treat. I don't know if I can trick my brain that much, but I can see how that would be really, really helpful. So thank you for explaining that. Now, that was the one that I wanted to talk about, just based on what I saw in the room in front of me, because I was sat right in the back corner and I saw it ripple. What would you, so obviously you've said to us that you're coaching a number of dental practitioners at present. What technique do you find is helpful that you could share with the listeners from a mindset perspective?
Yes. So one of the first things that I run all my coaching clients through in terms of the more awareness that you have around your thoughts, the more empowered you are to then, even without the additional, there's lots of techniques that I teach like my coachees on how to then empower themselves to really change their thoughts. But the first step is awareness. That's the foundation. You need to become aware of these thoughts that are coming through. And then once you've got that, then you can apply the next step, which is different techniques to change them. And so one of the best awareness exercises that I really love to share is around doing what I call a brain dump or a thought download, which is where when there is something that you've had stuck in your head that you're ruminating on that has gone round and round in circles in there, grab a piece of paper, set a timer for 5 minutes, and then just an uncensored, unfiltered brain dump of all the sentences that are in your mind. And then after you do that, read through every single one of those sentences, and next to each one, then you put a cross through it if it was a thought or an opinion and not based in fact. Now, the thing is, it can take a little bit of I guess like usually I supervise my coachees like because it's hard for them to identify things that they think are fact because they're their own self-limiting
Yeah,
beliefs that they've been
yeah.
carrying for a long time are actually just the thoughts and opinions and not actually rooted in fact. And so one of the hacks that I can provide to help you to ascertain which things are actually facts and which are thoughts is it something that everyone would agree upon? So if you went to a court of law and then you had to present this sentence, is it something that everyone in that courtroom would then agree upon is based in fact, right? So things like so that means it helps to filter out and help you ascertain that if something's just an opinion. So if we use an example like, oh, I'm not good enough, the thing is like that might feel like a belief to you and feel like a fact to you. But if you took that to a court of law where the job is for them to ascertain the facts, you'd find that, well, would everyone in the room agree with that statement? No, because how do you even define good enough? What does that even look like? And different people have different definitions of what that is. And so eventually, what you'll find with this exercise is a lot of the sentences you have running through your mind, which your brain is perceiving as all just true facts of the world that are unchangeable, you'll realize and gain that awareness. A lot of it are all kind of stories and beliefs that have just been picked up along the way but not intentionally filtered out or looked at. So that's I would say is like the first thing that would really help to improve that awareness. And with awareness, then that will sometimes be enough to help you change some of like the thought patterns that are going on in there.
Thank you. So, from a risk management perspective, one of the reasons that we at Dental Protection, as I know you're aware, engage with people like yourself, Trudy, is because if we don't take care of ourselves, we can't take care of our patients. And
Yes.
wellness is actually, in certainly in my view, one of the pillars of risk management.
Mm.
Because if, like I say, if you're not well, you can't help others. You can't pour from an empty cup. There's a reason when you fly that the flight attendant tells you to put your own oxygen mask on before helping others. And we're givers, we're healthcare professionals, we're carers, we give and we give and we give. You've mentioned being very emotionally attached to your patients. I too, I was going to say suffer with that, but I don't think it is a bad thing. I think it can be a bad thing if we don't know where to put that boundary in ourselves. But I think actually being a compassionate, caring human in our profession is an asset. And you mentioned yourself, it's why you have such strong connections and why you have such passion. So it's wonderful to be like us. But the problem is if you give and you give and you give and you give, and then there's nothing else left. And
Mm.
burnt out practitioners
Mm.
do make more mistakes. That is evidence. It's shown in the studies. They make more mistakes. They miss patients' body language cues. They communicate poorly. They don't diagnose as well as people who are not. One asset that we talk about in burnout or concept is this the work of Diaby about loading. And so the way to, I guess, understand it for those who aren't familiar with it is imagine that your life is a plate and you're holding this plate and you keep putting things on that plate. And so, okay, you go to university, you put the stress of work, you might be carrying some family stresses, exams are stressful, you might be building some debt. These are all things that we're putting on our plate. You might have a relationship. If it might be that you end up living together because, that's not stressful, or buying a property together because that's not stressful, or even getting married because we all know that weddings are just seamless and unstressful. You might buy a practice and bring more debt, more responsibility. My generation, Trudy, we're the generation in the middle. So I have teenage children and I have actually quite young parents because they had me quite young. But a number of colleagues of my age have parents who are much, much older and are needing to be cared for. So you're caring at both ends of the spectrum. And so you're caring for everyone, carrying all of this more on the plate. And then I've got to do some more CPD or I've got to train to be a specialist, right? Because I'm getting left behind. Everyone else is placing implants apart from me, more on that plate. And this plate gets heavier and heavier and heavier. And when it gets too heavy, we can crash and burn out. Now, at that breakfast, you said something to me that was so simplistic and obvious that I was horrified because I'd never thought of it before. And you said, because you were talking about having a lot on your plate, and then you said, why can't you just put the plate down sometimes? And I thought, why can't I just put the plate down sometimes or get someone else to hold it for me? So, can we just explore that idea of perhaps I don't have to do everything? Because I'd love to explore that with you right now, Trudy.
Yes, well, thank you for sharing that. I think what you just shared will probably resonate with heaps of people that are listening. And so basically like what we were talking about was really about that concept of how much power that language has, but then also what you choose to visualize, I guess, in yourself in terms of it's a very common analogy that people talk about juggling. I mean, that was the
Yeah,
name of the lecture.
it was.
Um, and also spinning plates, people can say, like, I'm trying to keep all the plates spinning all at once. And then what I talked about in that lecture was that I hadn't named the name of the lecture. I was told to talk on this, but
Hmm.
that I'm actually not a huge fan of using the word juggling priorities or juggling responsibilities, because if you're listening in, like to check in with your body, how does it feel to then visualize yourself or hear yourself saying that you're juggling things?
Feels
It, to
frantic.
me, it creates like, yeah, a sense of franticness, a sense of, oh, I don't know whether I'm going to catch the next ball, if I'm going to drop it. And it creates that sense of tension in your body. And so then what we explored was, well, what if you play around with that concept? And instead of picturing that you have all these balls in the air that you have to juggle them and that you're at risk of dropping them at any time. Just think about, okay, well, I've got two hands and I can hold two balls in each hand at a time. And then at different points in life, because life has ebbs and flows and times where things are busier and you do have more responsibility, then you've got times where it's less. And so you don't need to get rid of any of your balls, but sometimes you might choose to just intentionally place one down and then focus on these two that you're holding. And then when the time is right, you go and turn your attention back to them and then pick them back up again. And so if you just picture and visualize yourself the next time that you're telling yourself that you're juggling so much or you're handling so much responsibility, think about changing the way that you frame that with yourself, and you may find that it really changes the way that you feel when you are thinking about the things that you need to do. And it can actually be very empowering to think about the fact that you always have choice and agency in what you're taking on. And even though it may not change your situation in terms of you still have those responsibilities, by you actually engaging your mind, and this is science-based as well, is that one of the things that's a preventative to burnout is people being given access to choice and agency.
Yeah.
So if you give your brain more airtime to focus on the fact that, yes, you may have these responsibilities and they're fixed and unchangeable, but what you can change is the way that you perceive them, and to choose to give more airtime in your brain about how you are choosing to engage in this responsibility. Where, let's say, for your patients, there are things that you want to meet in terms of like your care for your patients, your compassion for your patients. But those are things that you choose to engage in because it matters to you and it resonates with your values, that you want to be a practitioner that looks after your patients to a high standard. So while it's something that you may feel that you have to do, perhaps it's something that you could reframe and say, well, I choose to meet those standards because it matters to me. That's part of my identity, being someone that provides that standard and level of care for my patient. And that can be something that can be applied not just in your professional life, but also in your personal life.
No, that's really helpful. And thank you for reminding me that I have agency and choice. And I'm being deathly serious about that, because I think sometimes we can get swept along. And I've been doing some work recently about this idea of how difficult it can be sometimes to say no.
Yes.
And why we say yes. And why sometimes, because I'm, as you know, I do a lot of work in burnout and create resources about it. But this idea that we're just saying yes, yes, yes all the time, and who that's for, and who we're helping with the yes, yes, and who we're hurting, usually us, and sometimes our patients, if we're yesing to the wrong things at the wrong times. So I do think that that is such a good takeaway message, that we do have agency and we do have choice. You would not believe how many times practitioners ring us up for a chat and their conversation is around, do I have to do that for that patient? No, you don't. If you don't genuinely believe it's in that patient's best interest, and or you don't genuinely believe that you are the right person to provide that treatment for that person, which can be for all manner of reasons, then no, you don't. And so, yeah, I think that's really powerful. Trudy, before we go, is there anything else that you wanted to share with our listeners? I feel like we've got so much from you.
We've covered a lot today. I might continue on the thread and pull on the thread that you just brought up. Is that when, in terms of like relating to saying yes to a lot of things, and this is just I have like these thought power statements and mantras that I practice. And this is one that really helps me with managing the yes, is that offering a different perspective to my brain in terms of the yes is, when I decide to say yes to something, I'm saying no to something else.
Yes.
So a lot of the time we will say yes, and then we get to a point where there's so many hours in a day, so many things that you can like manage. And then every time you give an additional yes, you're now saying no to probably something related to your well-being or your own self-care. And so that's something that might be helpful to some listeners out there that have the
It's
propensity to
amazing.
say yes.
It's so insightful, actually. It's amazing because it's not just about, it's not necessarily just you that you're taking from. So if you're saying yes, 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 are you getting home? Are you getting home not just for
Yes.
yourself, but for your
Mm,
partner? Do you have a family? Would they like to see you? I'm assuming they would. Like, what are you saying no to? It's really
mm,
powerful. And there are so many opportunities in life. There are so many things that we want to do. And sometimes if we say yes to too many things, it's the things that we want to do we end up not doing. And because it's often the simple things and the little things that you can let go, the things that might be personally meaningful to you. So I think that's a really good message, Trudy. Thank you. It's certainly one I need to keep in mind. So thank you so much, Trudy, for that relevant and helpful content. And thank you all for listening. We do hope this podcast was helpful to you, and we look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.